Let's talk a little bit about HIV and AIDS. HIV is an abbreviation which stands for Human Immunodeficiency Virus, and HIV is the name of the virus that causes the disease AIDS, acquired immunodeficiency syndrome. So I'm going to explain these terms right now. Human is relatively clear. It affects human beings. There's also something called an SIV, a simian immunodeficiency virus, which infects monkeys. So there are a whole family of related viruses. Immunodeficiency means that deficiency refers to that you do not have enough immune system. So deficiency means a lack of something, and in this case a lack of immune system, and it's a virus. So it is a particle which has to infect other cells in order to reproduce. AIDS, in contrast, is the disease caused by HIV, and it stands for acquired immunodeficiency syndrome. Acquired means that you get it from somewhere. Immunodeficiency is what I just explained. You do not have enough of the immune system. And what is a syndrome? A syndrome is a collection or several symptoms. So a person who's got AIDS not only has one symptom, but essentially a collection of different symptoms, and together this makes a syndrome. It's important to understand that it is not possible to get AIDS without being first infected. There is a clear and direct link between these two. However, a person who is HIV positive, and this means that the virus is present, a person who is infected is HIV positive, these people might not yet have AIDS. So the virus is around, but the disease might not have broken out yet. And as a matter of fact, the time span between the infection and the outbreak of the disease can be several years. And this is something that I'm going to explain over here on the diagram, on the graph on the right side. So how is HIV passed on from person to person? First of all, during sexual intercourse, specifically during unprotected sexual intercourse, there are microscopic wounds which form, and they allow for an exchange of infected body fluids, also, for example, semen and blood, and this is how it can be passed on. Always ask yourself, is infected body fluid passed on from person to person? And if it is, then this can be this allows also for the passing on of the virus. A second way is the sharing of needles by intravenous drug users. IV drug users are those people who inject the drugs into the veins. And sometimes these people share the needles. You have to use a fresh needle every time when you take a blood sample or every time when you get a vaccination. But IV drug users sometimes share needles, and basically the syringe with the drug is passed on from person to person. And this is a serious situation, because this way you can also pass on microscopic blood droplets which carry the virus. It can also be passed on from mother to child across the placenta. Before birth, it's possible. It is also possible to infect the child after birth over breastfeeding. And there's another way how it's possible during the birth process itself. If there is bleeding, there is bleeding from the side of the mother. But if this can also mean that infected blood of the mother enters the baby, and then the baby can also be infected. So that's also from mother to child. Now, blood transfusions and blood products theoretically can also pass on the virus from person to person, but because blood transfusions and blood products are now tested a lot, this is a rather rare possibility. It's not completely excluded because there is a small remaining rest risk, but essentially ever since the 1980s, when they were able to test for the virus, the blood samples are tested, and it's not an issue anymore. I included this here for the sake of completion. So it is important to understand that over the course of the infection, the number of viruses increases in the blood, and the number of lymphocytes decreases. And this is something that I'm going to explain over here. What you see is two diagrams superimposed over each other. Over here, this y-axis over here is the CD4 plus lymphocyte count. So basically, these are the number of this specific type of white blood cell in cells per cubic millimeter. And the CD4 is the so-called the CD4 T helper cells, and that's just their name. So here we've got the white blood cells that the virus infects, and over here is we have the HIV RNA copies per milliliter of plasma. This means basically represents the number of viruses that we have present in the blood per milliliter. The first thing that you've probably already realized is that this one over here is a logarithmic scale. So, and this one over here is a linear scale. So essentially, if you were to also make this one linear over here, it would be much higher. So it's the step from 10 to the 6th to 10 to the 7th is a huge step compared to a step from 10 to the 2nd to the 10 to the 3rd. So it's a logarithmic scale. So what happens? Over here at time 0 of 0 weeks, we have the primary infection. This is the time when the virus enters the person's blood, and of course the number of viruses is very low over here because only a small number of viruses is present at the beginning. And what happens first is that the number of viruses rapidly increases because the viruses reproduce, but then the human immune system starts to fight the virus and reduces the number of viruses again over here by about 9 weeks. So there is a huge initial peak in virus, but the human immune system is able to reduce the number of viruses rapidly again, but not all the way down. You still see that over here there is still 300 cells per cubic milliliter. Not cells. I'm looking at the wrong diagram over here. It's around 1,000 RNA copies per milliliter. Okay. So that is the thing at the beginning, but this one often is without symptoms, so people don't know that this has happened. So sometimes there can be a small swelling of the lymph nodes in the armpits, but many people do not realize that, and many people have a swelling of the lymph nodes anyway because of any other infection, because it's nothing unusual. So this one basically is often without symptoms, and then it's kind of reduced. And then over here, do you see the double line? It means that the diagram is broken over here, because over here we jump from weeks to years. So this is a very long time where you see that gradually the number of viruses actually goes up. And from a certain point onward, the number of viruses really increases very rapidly. And this is now the time when the people first start to have symptoms of AIDS. And over here, opportunistic diseases means that people now start to become ill of diseases that they normally would not get. And the reason is because their immune system is already so damaged by the virus. So you see over here the last part over here, the last couple of years, 2 to 3 years, that's basically when the people have the symptoms of AIDS. And before that, over the largest time span over here, it's called clinical latency. The people are infected, but essentially they might not know about that because they feel fine. And that's one of the problems why HIV is passed on so rapidly, is because the people do not know that they actually carry the virus. And therefore, they can more easily pass it on. So that's basically what happens to the viruses. Rapid increase in the beginning, peaking over here, then a rapid fall in the virus copies, gradual increase, and at the end a very rapid increase. Overall, you can say that over the course of the infection, the number of viruses goes up. What happens now to the number of CD4 lymphocyte counts? It's lymphocyte cells. These cells are the white blood cells that the virus infects, and the virus goes into the white blood cell, reproduces in there, and in the process kills the white blood cell. So what we have is the following. A rapid drop in white blood cells at the beginning because the viruses infect the white blood cells, but then the immune system recovers a little bit. And then over the course of many years, the number of white blood cells goes down. And from a certain point onward, the number of white blood cells is so low that essentially the human immune system is not able to fight off other normally harmless diseases, and the person can become ill of relatively otherwise harmless diseases, and these are called the opportunistic infections. The immune system by that time is already so damaged that essentially other diseases start to show up. So in a summary, essentially HIV, the virus, kills the very cells that are supposed to fight it. It attacks the immune system, and this makes it for the immune system even more difficult to fight the virus. So, as a last comment, is there any possible treatment for HIV? You can treat it, of course, but it cannot be cured, at least not now or not yet. There are certain highly effective medications, but the people will remain HIV positive, they will remain infected, but it is possible to significantly stretch this clinical latency period up to many years. So that is that's quite well possible. The danger of and the rapidness of the progression of AIDS also depends on which type of HIV virus the person carries, because not all HIV viruses are the same. There are also several subfamilies, and what I read somewhere is that if you were infected, let's say 30 years ago, in the 1980s with HIV, and if you're under treatment, then at that time the viruses were not as dangerous as they are right now. At least that's something that I read. So there are people around who have been infected with HIV now for over 30 years, and there are still AIDS has not broken out yet. They are under treatment, of course. You have to reduce the viral count, but at that time apparently the virus was also not as dangerous as it is right now. But that is, I would say, already going a little bit beyond what I intended to talk about anyway. So that is basically the thing. You should know the differences between HIV and AIDS and that they're related, different ways of transmission. It's not possible to transmit the virus over insect bites, for example. They've done experiments like that, and it's not possible. And it's also not possible to transmit the virus over casual day-to-day contact. But if infected body fluids with a sufficiently high concentration of virus, if these body fluids are involved, then there is indeed a chance of passing on the virus. And last, as a summary, over the course of the infection, the number of viruses goes up and the number of lymphocytes goes down up to the point that the immune system is so damaged that the people start to develop AIDS, and ultimately the final consequences is that people will die. And this usually happens around 2 to 3 years, if not treated, 2 to 3 years after the onset of the first symptoms. So I would say that I'm going to call it quits now. I hope that this has given you now a better insight on the issue of HIV and AIDS.